Welcome to BizTech's Technology Show. Now, this is a show where we highlight how technology makes an impact on people's lives. Now, today we feature Maran Virumandi. He's the managing director and founder of DoctorOnCall. Maran, welcome to the show.
Thank you, Brian. Pleasure to be on.
Now, Maran, give us an overview of DoctorOnCall and how you've evolved in the business since you started it in 2016.
Right. DoctorOnCall is a digital health platform. Effectively, what we do encompasses a whole range of healthcare services from telehealth services. That was our initial offering in 2016. We also do medication delivery, in which we offer medication delivery right to the doorstep of the patient's homes and offices. Specifically prescription drugs, and we've now expanded the range to 10,000 over SKUs. Back over to 2017, we then identified healthcare education as being a major issue in terms of people consuming healthcare services. They were unaware of prescription drugs, side effects, symptoms, and having a lot of myths or challenges in their heads, right? So we then launched our own healthcare blog and portal. It's really off to a roaring success, and since then we now have about 2 million people visiting us on a monthly basis.
Fantastic.
To consume our healthcare content, and we've gone to make it really easy to consume, right? From videos to listicles to FAQs and forums which are moderated by doctors, answering many of the questions that the patients have. Based on our early success, we understood that the healthcare market in Malaysia really needed payer intervention by the insurance companies, the corporates, who were big payers of the healthcare bills. And so we crafted specific products for the insurance market and the corporate market, called Doc Assist, Doc at Work. And we now count about 10 insurers and a couple of hundred corporates who have embedded our product offerings into their medical cards or their insurance programs. So effectively, it allows their members and their employees to use our services. Fast forward, we launched our online pharmacy, and 2020 happened when we partnered the government to offer our telehealth services. And since then, we've broadened our range of services to include booking of specialist services, lab services, as well as home nursing. So now we like to think that we are able to offer end-to-end services from telehealth right up to having the doctors visit you at home, or you being able to see them at their clinician office.
Now, so it sounds like you've built a little ecosystem for yourselves in terms of partners and customers. So you partner the insurance companies, you partner healthcare payers in general, so that's corporate as well. You partner the Ministry of Health as part of your offering. So what is your business model like? How do you make money?
So spot on, Brian. We, as an ecosystem or a platform play, we help, we monetize from both the supply side and as well as the demand side. So in short, with the insurers, we have a subscription program in which they sign up, and we collect a per member per annum fee to service their members' healthcare needs. Right. We also charge for specific interactions, be it for the consults or the medications or the medication deliveries and the bookings, on top of what we already offer to the insurers. We also partner pharmaceutical companies and offer medical content or effectively, in layman's term, advertisements, right? Because of the restrictive nature of medical advertisements, we offer the eyeballs of 2 over million Malaysians, and now expanding across the region, coming to our site, for them to read, properly curated articles that are provided by these pharmaceutical companies too. Moving forward, we also work with the pharmaceuticals and the hospital groups, the clinic chains, to actually also offer subscription services for them to be able to leverage on our technology platform to reach out to either the individuals or the corporates and the insurers.
Now, how do you get around the regulatory framework that is healthcare? Because one of the things that you're doing, it's a very highly regulated industry. It is also something, for example, in pharmaceuticals. Malaysia is not a prescription market, it's a dispensing market, so doctors can prescribe just as pharmacies can. How do you do that online? What specific regulations do you have to comply with?
Right. So there's a whole host, like a plethora of regulations, and you rightly said that it's one of the perhaps most regulated industries in Malaysia, or be it in any part of the world, right? So we took a pragmatic approach. We worked with our legal team to identify the way we could provide our services in a responsible manner, while at the same time ensuring that we could meet the customer services and customers' expectations. But I think the trick was to engage Ministry of Health early on. And we've been fortunate to have visionaries in the Ministry of Health, comprising of, Tan Sri DG, right, the Director General, who was, I suppose, responsible for setting up multi-agency, organizations such as Digital Health Malaysia, to work with participants of the industry such as us, to then craft out approaches as well as guidelines for us to work within, in the absence of clearly defined regulations covering telehealth or medications or data being held by organizations such as ours. So the way has been, through a collaborative exercise, working with the Ministry of Health, the other participants in the industries, as well as making sure that we keep the customers happy.
Now, how has so obviously you've evolved your services over the last few years. How has your customer base evolved since you started in 2016?
So it's interesting to reflect back, right, on our early days. So being the first in Malaysia, and I think like perhaps even one of the first few in Southeast Asia, people were not too clear on telehealth and digital health as a whole, and so the people or the customer groups that were using us were folks who really didn't have much options. So in the early days, a lot of the people reaching out to us were talking about sexual health, men's health, and women's health. Health topics which they found it to be a social taboo, or areas which they were not comfortable sharing in a physical clinic, right? Because of their misguided fear of actually sharing this information with a medical practitioner, right? And so they would use our forum, our telehealth, to actually talk to a medical doctor about, the dangers of, say, a risky interaction that they had, right? Or the dangers of that, and it could even encompass subjects such as family planning. But as our traffic grew, and the insurance companies and the corporates started adopting us, and Ministry of Health themselves started using us, and the pharmaceuticals started trusting us, I think that gave a very clear signal to the customer groups. And now we count a pretty wide demographic or a slice of the Malaysian demographic using us, from people who have chronic conditions or have long-term medication needs, such as patients afflicted by diabetes, hypertension, heart problems, and cholesterol, or people who need a way to actually research on a topic that is, acute or expensive for that matter, right? People who are looking for fertility treatments or surgical interventions, and there's no bookings.com for healthcare where you can just jump on there and find out the price of a hotel in Bali,
Yeah.
sitting thousands of miles away. And the current approach of asking your aunt and your cousins who happen to be in the medical fraternity just doesn't work. And so now we're getting a huge traction of our or part of the demographic using our services.
Now, Maran, you started this business in 2016. Did you have co-founders? How did you start the business, and how have you been funded so far?
Well, I was fortunate that I came from a consulting background and had a really good set of people who were guiding me as well as working with me. So Hazwan Najib, my co-founder, joined me pretty much early in the journey. When I reached out to him, and I stumbled into the healthcare space, right, coming from technology and management consulting, and saw how healthcare, due to the regulations, due to certain prohibitions, was at least 10 years behind the other industries, be it the fintechs or the telcos, in terms of adopting the new technologies. And so I reached out to him and said, mate, we do this for a living, guiding clients down this journey. So why don't you join me? We went off to research the big players in the US, be the Teledocs, the Amwell, or in China with Ping An Good Doctor and many other players. And we thought that this is a great opportunity to jump in. And so it's been a journey of investing into our own proposition. So we've been self-funded thus far. But over in 2018 and 19, we pretty much exhausted the funds because we didn't know that the journey was going to take a fair bit of time and a fair bit of effort and capital. And we've been also very fortunate to get family and friends, especially a couple of the partners from the consulting firms, as well as people who have a like-minded vision that healthcare in this part of the region, right, Southeast Asia, needs to get on with the times, right? And so they saw that we had put in the hard yards, and they've then joined us in that journey.
Okay, so how much have you raised so far in terms of investment?
So I'm unable to disclose the numbers for you, but I would say that we've again take a very very practical approach, right? We've built all our solutions in-house. So having led technology projects, I got in our developers and started working with them. We also have a small office in Bangalore in which we leverage a partner to actually do some custom development. And so I would say that the capital that we've raised is a fraction of what we compare to our peers around the region, because of the reliance on ourselves building very dedicated products for our customer groups, and also the marketing approach, which is more health education focused rather than burning money on Google's or the Facebook, which sometimes really evaporates your marketing budget.
No, absolutely, because there's a scary statistic that I just read a couple of days ago. Out of every dollar of marketing spend in Australia and digital advertising spend, 82% goes to Google and Facebook. And this is another, so it's validating what you're saying as well in terms of money that's literally evaporates in front of you as you spend it. Out of every dollar in startups in the Silicon Valley, over 60 cents goes to Facebook and Google. That means every venture capital dollar 60+% goes, 60+ cents goes to Facebook and Google. So it's not going to the product, it's all going into digital ads. So I think that that's something that probably validates why people like yourself are able to build out. Yes, it takes a little bit slower, but you've got a much more solid foundation as a result of that.
You're right. You're right, and we've learned it. I mean, I'll just to echo that fact, right? We had our content team look at the Google ads in the early days, and I think I never forget that he turning back to me and said, Maran, if you do go at this rate, you're going to pay for a BMW by the end of this quarter, right? Because it really consumes, right? If you want to run a multidisciplinary campaign, right, to cover the multiple specialties. And that's when we took a step back and we decided that we'll take the part of developing all this health content and be the WebMD of Malaysia and this part of the region. And that's resulted us in bearing a lot of dividends, but also allowed us to sleep at night, because just in case you switch off your social media tab, you're not going to have a plummet in terms of your customer adoption and rates as well as revenues.
Exactly. Now, your business has probably been impacted quite positively as a result of the pandemic. Perhaps you could share with us how the dynamics of the business has changed.
Right. So prior to 2019, and so it was interesting, right? Because we were in China in December 2019, just prior to the outbreak of the pandemic. And we were talking to the likes of Ping An Good Doctor and Ali Health and the rest of the players in China. We're talking about doing hundreds of thousands of consults on a daily basis. And it just validated our idea that this was going to be the way of the future. But they were just restrictions around the certain part of the payer groups and part of the governmental groups in terms of, or pharmacy groups in terms of adopting that. And then we came back to Malaysia, we ran a business as usual. And then we got a call from the Ministry of Health, by the Minister's office, asking us that their phone lines were inundated due to the outbreak or the misinformation that was being spread around about this, so at that point in time called the Wuhan virus, right? And we then offered our telehealth solution because that was the right thing to do, right? You just couldn't have your CDC hotlines being burnt out. The patients needed to talk to the doctors. And by providing our platform, we had about 5 million people reaching out to us during or through our platform to the Ministry of Health professionals during the height of the condition. But the key thing that changed at that point in time was this perception that telehealth was just some foreign or some nice to have in the minds of the customers, as well as the minds of the providers and the payers. So this mind shift, followed by that was also reinforced by the long durations, right, of MCO or the mandatory control orders, the restricted movements, the fear of people going to hospitals, especially people who are in chronic conditions or who are at risk, allowed them to continuously try the digital health platform. Okay. And so that went on for a while. It tapered down a little bit towards the back end of the year, but then it picked up, unfortunately, due to the condition. And now I think it's beginning to be, a real alternative for people to in seeking for healthcare services.
And Maran, have you also seen a take up because of this increased need for information regarding vaccination?
Good point, Brian. And I was actually really surprised as I early in the year when I started talking to a whole bunch of folks, older folks, right, and family members about the misinformation surrounding vaccination, from conspiracy theories to myths to a palpable fear of why we, the older folks, right? I'm talking to the folks who are over 65, being the guinea pigs of a government-run program, right?
Okay.
And it it's just all over WhatsApp. Fortunately, I don't think Facebook really allows for much of those myths, but it's all over their WhatsApps, and so they are now beginning to turn to credible sources, right? And that's where we see ourselves playing again a pivotal role in addressing this misinformation, similar to the role that we played this time last year with the whole COVID-19 fear.
Okay, Maran, because the shackles and the mental challenges of adoption have been shattered because of COVID-19. So companies like yourself have ridden the wave. What new initiatives are you rolling out or have rolled out that will accelerate the adoption of digital health and also then benefit users tremendously?
Right. So um, we had a long hard look at our plans moving to the 5-year plans, right? And we decided that we really need to accelerate that into 2021 to not only catch the momentum, but also to make available these services which are out there. Um, Besides providing effectively a platform for healthcare providers and payers to interact with and patients to procure their services, we see that the biggest area that will benefit the patients, right, would be a platform that provides their healthcare information regardless of the different providers. So just to illustrate the points, if you were to walk into different hospitals within the country, you would literally not be given your healthcare information in an easy to access manner. You
Yeah, because
obviously
it's
get your
all
file.
distributed data.
Exactly. And so to have the information on a single platform so that your providers or your receiving providers or your new providers will be able to make those decisions without having to impose another set of diagnostics, right, would greatly reduce the barriers in patients seeking for healthcare, alternative treatments, or for them to even lower down the entire burden of healthcare cost.
Yes.
Right? And so we came up with this term, right, to be the maps of healthcare, effectively like how the maps, the financial healthcare provider in Malaysia, has allowed for information to financial information to flow seamlessly across the multiple banks, and we see ourselves now that we're receiving a huge amount of traction and traffic, being in this enviable position to actually offer this, right? So regardless of the different providers, the patients can come in and have their healthcare records stored in a single repository, and it'll be captured through their multiple interactions with the different providers or the payers. So your claims data, your prescription, your health records will be all kept over there.
And would you be doing that? Would you hold that repository?
So yes, the information will be within our storage, but nevertheless, it's something that the patients can opt to keep, right, and have it live in our systems.
Now, Maran, as long ago as 1996, when the government rolled out the MSc telemedicine initiatives, of which I worked on as well, there was one of the flagship applications was of the 4 healthcare applications was GDS, Group Data Services. This is exactly what it is. It's central repository of data. How will you get all the healthcare actors, so the payers and the providers, to share that information and leave you as the custodian and not the government or some other entity?
Well, Brian, I had to correct any misconception if there's any out there that we're going to replace the role of the regulators or the government agencies in storing those data. Just to take an example, right, a leave out of the page of the Ping An Good Doctors or the ZocDocs in the US, they, through the provision of their services, right, are able to store large data sets of the patients. So assuming, just walking you through a journey, the patients will come, consult a doctor, receive prescription, go on to purchase the medications, have it delivered, make the claims with the payers, and keep repeating that, assuming that they're a long-term medication or chronic patient, right, throughout the monthly cycles. That would mean that we'll have, we'll own those multiple interactions and store those data, and be able to, again, then to provide those data back to the patients, right? So should they want to meet another provider, they can always pull up their records at their fingertips and show, this is what I was prescribed and this is what I've been consuming, and here's the diagnosis for the various consults. And so it's a approach that's going to be more of requesting the patients to make those decisions, and then for them to request their providers to opt in, rather than us, trying to corral the various provider groups or the payer groups to put their information set onto our platform. So that's going to be, a hard task to convince people to do so.
More pragmatic. So you're building basically the data sets from transaction data.
Correct. And again, the names I mentioned to you earlier, with the likes of ZocDoc and Ping An Good Doctor, or even Practo in India, have turned out to be the de facto National Health Record Registry in their respective countries. I mean, obviously there are other various players, but it's just at the pace that they grow, they've become, almost like a utility. And I think that will serve the public a lot of good.
Now, Maran, it sounds like you've got a really good platform built over the last 5 years. What's the strategy for you? Because it sounds like you're heading to an exciting phase of growth. And for growth like that, you need money. What's your strategy in terms of funding all these initiatives?
Right. So the last couple of years has been, mostly self-funded, as I mentioned, and we've reached out to family and friends and business partners to take part in our growth story. And I think with the way we're moving forward, and the huge amount of traction that we're getting, which is translating to revenues, things are looking good. But nevertheless, to build these maps of healthcare that we just mentioned to you, right? The digital healthcare exchange, and then to make big bets into the new wave of technology that's coming onto healthcare, like artificial intelligence and machine learning, data analytics, and building our own, cybersecurity capability, will require heavy capex investments.
Yeah.
And so we are in discussions right now with a select group of venture firms, as well as platforms, to decide what is the best way to actually have strategic investments into our platform, right? People who understand the long-term nature of healthcare and understand the great yields, because you just need to look at the healthcare assets such as IHH and Raffles on the stock markets, and understand that they do have great multiples, and they are great investments. They do have great degree of stability to the investments, and we would like to onboard them and also benefit from the guidance and the insight that we can get from these parties.
That sounds very interesting. But Maran, final question for you. What advice would you give entrepreneurs so that our audience can learn from the lessons and mistakes you and your team have made since you started, particularly because you've largely bootstrapped this business?
Um, I would say the key, if I were to reflect back, the key strategy that we had that enabled us to take this long-term view in terms of investing, in terms of bootstrapping, and mind you, the founding team haven't received a salary for the last 5 years. Uh, have has been about getting a group of people who share the passion and share the vision, right? Be it the young developer or the co-founder and the chief technology officer or the medical team, right? We've been blessed that we've had a fair amount of talent in our country, and people who really understood that they're here to make a difference, right? And there are case studies that shows that we can make a difference. And once they started drinking from that Kool-Aid, it then set the stage for us to actually go for the marathon. And when the time comes, it comes, right? And they were prepared also to cope with those sleepless nights in terms of working through and onboarding the partners and going for those for the hard yards.
Maran, on that note, thank you very much for taking the time to be on the show.
Pleasure is mine.
Now, I'm Brian Fernandez, and I've been speaking to Maran Virumandi. He's the managing director and founder of DoctorOnCall on BizTech's technology show. Check out www.biztech.asia for business and technology conversations.